We already know that a lot of Filipinos are dying from heart disease every single day. Tonight, we will be learning who among those Filipinos are affected, because we used to think that heart disease is only for adults. But in this lesson, in this session that we will have tonight, you will realize that heart disease, even the first sign of the development of the hardening of the arteries in our blood vessels in our heart, are starting to happen in childhood. So that means parents who are listening in our webinar right now, who are joining us, you have something to do with the development of those fatty streaks in the blood vessels in the heart of your children. I'll be showing you here some landmark studies that will tell you how fatty streaks are being formed in the blood vessels of children and how heart disease is being developed, and what's the expected age, for it to cause heart attack to a certain person. Now, it was in this landmark study that was published in 1953, if you can see in your screen now, that radically changed our view about the development of heart disease. So this is a series of 300 autopsies performed in the United States battle casualties during the Korean War. Now, as you can see here, average age of coronary artery disease was found at age 22. And take note, 22, but 77% of those hearts, they have seen some gross evidences of coronary atherosclerosis already. So atherosclerosis means hardening of your blood vessels. Those are basically because of the cholesterol plaques that are stored inside your blood vessels. So meaning, when we say gross evidence, this is visible to the naked eye. You don't even need to place it in the microscope for you to see that there is atherosclerosis or hardening of the arteries. Okay, now some of them have even clogged up to 90% or more. You see, at that age, they were able to see about 90% occlusion of the blood vessels in the heart at this age group. Now, as the editorial of the American Journal of Medical Association have concluded, this widely cited publication dramatically showed that atherosclerosis, again, or the hardening of the arteries, appear in the coronary arteries. The coronary arteries means the blood vessel in your heart. Okay, now you will see here that years and decades before the age at which coronary heart disease becomes clinically recognized a problem. And so the next question here is that, how young does it go? Now, this might be surprising to you, but here is actually the evidence. Fatty streaks, which is the first stage of heart disease or hardening of arteries, was found in the arteries of 100% of kids by age 10. You see? So what's accounting for this buildup of plaque even in childhood? So if you come to think of it, if you have any kid in the house right now, aging 10 years old and over, tendencies are they already have the heart disease. So later on, we will learn what increases the risk, what increases the chances of developing this atherosclerotic plaques or streaks in the blood vessels of your children and yourself as well. Now, during the 80s, we got the first clue basing on this study. This is what we call the famous Bogalusa heart study. Now, they look at the autopsies of those who died between ages 3 and 26. And the number one risk factor they've found out in the development of atherosclerosis is simply the cholesterol. Now, looking at the figure here, you will see the stepwise increase in the amount in their arteries covered with fatty streaks as the level of bad cholesterol in the blood increases. So I'm sure you know what the bad cholesterol is all about. We call it the LDL, or the low density lipoprotein. So if you get yourself tested in the laboratory for a lipid profile, you will find there your bad cholesterol or your LDL. So this is a powerful predictor for the development of atherosclerosis. Okay, but as powerful as this was only looking at 30 kids, okay, in this study. So now they decided to study 3,000. Okay, this is 3,000 accidental death aging 15 to 34. So after thousands of autopsies, they were able to produce a scoring system to be able to predict advanced atherosclerotic lesions in coronary arteries of young people. So here you can see that the higher the score, the higher the likelihood that you have this lesion growing in your heart. So that means you have that atherosclerotic plaques growing in your heart and narrowing the blood vessels of your heart. Now, say for example, if you smoke, your risk goes up a point. Okay, now if you have high blood pressure at such a young age, that's 4 points. And if you're obese, that's 6 points. But look, if you have high cholesterol, that is the worst. That is having 8 times worse risk than smoking. So here, this is predicting your likelihood to having a lesion in your heart basing on this scoring system. So let's say you're at age 16, okay? You're only age 16 with relatively high level of cholesterol, but you do not smoke, you're not overweight, your blood pressure and your blood sugar are normal. So there is just a few percentage chance that you already have an advanced atherosclerotic lesion in your heart. So that means there is less chances that you have hardening of the arteries in your blood vessel. But see, if you don't improve your diet by your 30th birthday at age 30, there may be 1 in 5 chances of having serious heart disease. Okay, and if you have really high cholesterol, your risk will be as high as 1 in 3. But say you bring your diet to lacto-ovo vegetarian. So as you can see here in the figure, you're down somewhere here. And if you exercise to boost your HDL, you can go down a little further. So that's how important it is that we start modifying our lifestyle, because every simple change may have a good and positive effect with our heart health. So what this shows us is that even 15 to 19-year-old atherosclerosis or hardening of the arteries has begun in a substantial number of individuals. And this observation suggests beginning primary prevention at least by the late teenage years to ameliorate every stage of atherosclerosis and to prevent or retard the progression of more advanced lesions. So this is as simple as starting our kids on a low saturated fat diet, and you may see a significant improvement in their arterial function by 11 years old. Because we can see now in the studies that exposure to high serum cholesterol, even in childhood, may accelerate the development of atherosclerosis. And of course, consequently, the long-term prevention of atherosclerosis might be most effective when this is initiated early in life. Now, you can see in this study, it says as early as 7 months of age. So again, as you can see in the figure, atherosclerosis or hardening of arteries begins in childhood. And remember, by age 10, we were all kids, and the fatty streaks, the first stage of disease, is already there. And then the plaques start forming in our 20s, then worst in our 30s, and then can start killing us off. Now, in our heart, it's a heart attack. In our brain, it's called a stroke. In our extremities, it could mean gangrene. And then in our aorta, it's an aneurysm. If there's anyone joining in this webinar now that is older than 10 years of age, the choice likely is not whether or not to eat healthy to prevent heart disease. It's whether or not to arrest and reverse the heart disease that we already have. Now I'd like to show you the 2019 guidelines for prevention of cardiovascular disease. So this is actually the first time that the American College of Cardiology and the American Heart Association have put together multiple guidelines into one comprehensive package in an attempt to prevent patients from having their first cardiac event. As you can see, the first focus here in the guideline is a patient-centered approach to comprehensively prevent using a collaborative model with a team of multiple specialists, including physicians, nutritionists, smoking cessation experts, and the goal here is to achieve a team-based delivery with shared decision and evaluation on how do you help patients to attain a sustainable lifestyle for them to prevent any cardiac events. Here you will see in the primary prevention, the ABCD as primary approach to patients with atherosclerosis. This is exposing lifestyle change on a team-based care. You see, so we have here, even if we provide or we prescribe medicine to patient, we want to monitor and we want to control their blood pressure, their cholesterol, their cigarette intake, their diet, their weight, control their diabetes, and of course their physical activity. Now, in this algorithm, you will see here that number one emphasis basically to prevent atherosclerotic cardiovascular disease or hardening of your blood vessels in the heart is in fact adherence to healthy lifestyle. So that means we implement this to patients at the onset of the disease and as maintenance intervention. Now, going back to cholesterol, we know very well that cholesterol are only found from the food that we eat, something that we put inside our mouth. And unfortunately, the only food-based source of cholesterol are animal-based products because we can never see cholesterol from plant-based products. Now, other cholesterol that we can find in our blood is actually coming from our own production, indigenous production of our cholesterol. So that means, we don't even need external source of cholesterol for our body functions. Basically, we need cholesterol. Our cells needs cholesterol. Our hormones needs cholesterol, right? But our body produces its own need. Unfortunately, what's happening now is that we have too much intake of cholesterol from exogenous sources. And so basically, as you can see in your screen now, you'll find there that the cholesterol component in the blood that each person have is in fact a composition of the cholesterol produced by the blood or by the body, and then the cholesterol from what we eat. Now, this is just giving you an idea of how much cholesterol we're consuming every single day, depending on the food choices. Now, as you can see, all these cholesterol sources are coming from animal-based products. But aside from cholesterol, I will also want to emphasize about saturated fats, because as we have explained earlier, in the management of atherosclerosis, we need to manage patients with high cholesterol in the blood, or we call this hyperlipidemia. So the general principle in managing patients with high cholesterol level is to reduce their intake of saturated fats, and basically especially animal products, and of course the trans fatty acids and the omega-3 fatty acids. But what we need to increase in intake for patient is, number one is fiber, number two is omega-3 fatty acids, and of course the plant sterols, right? You can find good fats from plant-based sources. Now, in terms of saturated fat, I want to introduce this to you because this is really important. Please take note that we have polyunsaturated fat, we have monounsaturated fat, and we also have the saturated fat. So these are the types and the sources of fat, right? Now, for polyunsaturated fat, we have omega-3, which is anti-inflammatory. We find them from in flax seeds, chia seeds, and also sometimes in fish. And then we also have omega-6, which is also an unsaturated fat. Unfortunately, this is pro-inflammatory. Now, another source here is monounsaturated fat, which is mostly found in plant-based products. So that's example here, very famous, is olive oil. But let me introduce here and emphasize saturated fat. So we have many types of saturated fat. So we have lauric acid, stearic acid, palmitic acid, and myristic acid. But generally, it is divided into basic types, including neutral saturated fat and harmful saturated fat. So coconut oil basically is a neutral saturated fat. Dark chocolate is a neutral saturated fat, and then unfortunately palm oil, meat, and then butter are harmful saturated fat. But again, at the end of the day, all of these are saturated fat. As you would have noticed, we don't have such thing as good saturated fat. All right, so at the end of the day, they're all saturated fat. They will drive your liver to produce more cholesterol than it is needed. Okay, now here in this study, I want to show you that there are really areas in the world where heart disease is not even existing. So now, as you can see, the diet are centered around whole food, plant-based diet. So examples are potatoes, bananas, cassavas. Now you can see that coronary artery disease is not existing in these areas. I also want to show you here some of the studies that were conducted in terms of coronary artery disease reversal. So you may also look at this and search about them. So Dr. Dean Ornish and Dr. Caldwell Esselstyn, I was privileged to meet them in person and hear them talk and learn from them. Now, these people are legendary in terms of implementing lifestyle therapy for coronary artery disease. So these are the first people who were able to establish that heart disease can be reversed utilizing lifestyle therapy. Now, in this study that you can see in your screen right now, so they were able to implement intensive therapeutic lifestyle, including plant-based diet. Of course, physical activity is included, and of course, stress management, and then psychosocial encouragement through a support group. So I'm talking in particular about the Ornish Lifestyle Program. So this is called the Ornish Spectrum. So in the United States right now, the US Medicare is in fact subsidizing this type of program already. They would reimburse a patient undergoing this type of program. And here you will see a significant difference between the lesion in the heart, and then of course after the intervention you will really see a significant change. So you will see that the blood vessel is opening again. Now, this is another study that was conducted by Dr. Esselstyn. You will see here in this angiogram there is a very obvious narrowing of the coronary arteries, but after a year in the program, there is an evident 30% regression of the coronary artery lesion. Now, another set of evidence here is a clear narrowing again of the coronary arteries, but after 30 months of intensive therapeutic lifestyle change, including whole food plant-based diet, and of course physical activity, they were able to see reversal after 30 months. Okay, now my question here is that, is it really a coronary artery disease or is it a culinary disease? So here we can again clearly see the role of intensive therapeutic lifestyle, the role of dietary changes. And so I wanted to introduce to you culinary medicine. In fact, culinary medicine is a new evidence-based field of practice in medicine that blends the art of cooking and the science of medicine. The goal in culinary medicine is to introduce nutrition education, cooking skills, and of course to motivate healthy behaviors among patients. In here, we talk about what we eat, how do we prepare it, what do we put in it, why do we have such food preferences, and how do we deal with unhealthy cravings. Our goal here is to motivate and help our patients sustain their healthy eating patterns. And so in our clinical practice, in case like we may need to prescribe medicine for patients like this, say we need to give clopidogrel and we need to give rosuvastatin to our patient, we never forget to prescribe nutrition to our patients using recipes. Okay, so well, at the end of the day, RX sign actually means recipe. So that's the meaning of RX, right? And so literally we prescribe legumes, for example, 1 to 2 servings in each meal. So here, this is just another session that we had learning about heart disease. It's good to know that it is starting at an early age, and so that we can also help and prevent our kids, to develop fatty streaks. It really depends on the food that we prepare on the table, especially as parents. We prepare the food, we serve them the food, they just eat them, right? And then we train their taste buds as well. So whatever we feed them, they got used to it, and then when they grow up, they feed their family the same thing. So that's how it is to pass lifestyle practices from one generation to another. But we can do something, now we know the cause, and so we know what to do next. So you start, and you can start this on your table right after listening to our program tonight. Start it on your table, start learning on what to prepare food in your family. So I'd like to invite you to attend in our next coming sessions, because we will be learning more about food preparation. Especially tomorrow, we'll be playing some of the recipes that you can actually start specifically for patients with heart disease and then hypertension, because tomorrow night our topic will be hypertension and the salt shaker. So I hope you learned something from the discussion tonight. I know it is short, but it is very important. Remember, there are over 200 Filipinos who are dying of heart disease every single day, and heart disease is the #1 killer in the country. Yes, we're afraid of the existing pandemic, but again, there are over 200 Filipinos dying of heart disease every day, and this is within the control of our lips.